Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening. Meet Advanced Benefit Consulting, an award-winning boutique benefits broker and compliance consulting firm that offers comprehensive benefits and compliance consulting. We offer personalized service and the ability to work directly with the owners. We invite you to contact us or connect with us on LinkedIn and include us in your broker consultant search.
Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Cociu, President of Advanced Benefit Consulting. And I want to welcome my guest today, Craig Lack, President, and Sean Casey, Chief Legal Officer for Catilize Health, a third-party administrator that specializes in Medical Expense Reimbursement Plans, or MERPs, as they're called, among other things. Welcome, you guys. Thanks for being here.
Thanks for having me, Dorothy.
You know, I've known Craig for many years in the industry, and I met Sean last year, and we've been working together a bit in the last year or so. I've been doing some consulting work with you guys. So I feel like I know you guys, and I want other people to understand what you guys are doing, because interestingly enough for me, I've never covered MERPs on this podcast before, which is kind of strange because I thought I've covered every cost containment type of situation out there. But for whatever reason, I'm not sure why, we haven't covered those. So what I want to do today is really let the audience understand what these plans are all about. So if you wouldn't mind, let's just start with the basics, and let's just assume that I know nothing about them, so that for the benefit, of course, of the audience, because they may know nothing about them. This is one of those kind of unknown things that either you know a lot about them or you know nothing about them. That's kind of what I've seen in the history, with all the plans. And as you guys know, I have a very strong self-funded background, so these have always been of interest to me. So let's kind of start from the beginning. As I said, tell us what exactly is a MERP and how are they used most frequently? And the question that I get asked most often is, are these related to or similar to an HRA? So why don't you guys just explain it to us?
Well, I'll give you the high level, and then because Sean is an attorney, he can give you, code sections.
Of course he can.
At its essence, a MERP is a medical expense reimbursement plan. And it is basically semantics. It is a health reimbursement arrangement, aka HRA. So in that sense, when you see that in print, it's probably interchangeable as you read it, HRA and MERP.
Sean, I know you have something legal to say.
Right. Well, I'm more focused on the code and implementation rules and making sure that, we're legally compliant, of course. And as everybody knows, ERISA is spread across multiple sections of the United States Code. It has its own Title 29, where most of it's laid out, but there's a substantial tax relevant portion that's under Title 26. And so, the HRAs generally, everybody knows, arise under the Internal Revenue Code, Section 105, and uses multiple other code sections, 213, 223, 5000, 9815. We've got a compendium of legal support for the MERPs that we implement, which are proprietary to Catilize in many respects. We have trademarked our MERP as a SIRA, a Spousal Incentive Health Reimbursement Arrangement, and that is going to be embodied in multiple code sections that we have studied, that we're very familiar with. And, we've used a lot of the Code of Federal Regulations implementation language to draft our plan docs, our ASAs and BAAs, so that we can ensure our clients are fully legally compliant, which is of special import today because the ERISA code was changed under the Consolidated Appropriations Act of 2021. That imposed personal liability on health benefit fiduciaries. And so that personal liability is well known to folks that manage other types of ERISA plans, 401ks in particular. Mm-hmm. And, as many people know, the Schlichter Law Firm and several other very large class action law firms have been very aggressive in enforcing compliance with the 401k provisions of ERISA. And now we're seeing the class action law firms enforcing these personal liability issues on major corporations across America. So that's given us an extraordinary opportunity to modify our SIRA, our plan docs, our SPDs, and things to further enhance the indemnity and reduction of liability and complete mitigation of liability of fiduciaries of health benefit plans.
Spoken just like an attorney, right? Right, Craig? We're gonna tease you about that all throughout this podcast, I'm sure, because something will stay. This is what it is, and then you guys will go into all the details, which we appreciate. I appreciate attorneys. I have to work with attorneys all day long because of what I do with my compliance work. So I truly appreciate that. Well, let me get on to the next question. You covered a lot of stuff there in that intro. Generally, are MERPs used as a standalone plan for the employer or alongside other plans to complement them? When are they most often used?
Well, let me give you some context. If you talk to our founder, Kevin O'Kane, he would tell you that MERPs have been around since the 1940s, despite the fact that nothing was actually in print until 2006. So I can only go back to the 80s. For those of you who don't know Dorothy, we're on a podcast, and unlike her, we've probably known each other 25 years, but I didn't start in high school like she did. So keep that in mind. So going back to the 80s and 90s, I can tell you here in California, where I live, those MERP plans were integrated with the employer plan sponsors programs for many, many years and have been used pretty much exclusively that way. Coincident with the passing of the Affordable Care Act, what they did was they outlined the ability to apply an HRA or a MERP integrated with spouse's plan. And therein lied the advantage that had never existed before.
Sean, I know you have something legal to follow up with.
How did you know, Dorothy? Thanks for giving me a chance to interject. So, yeah, in fact, we've seen some extraordinary developments from the Internal Revenue Service, wherein they've released revenue notices and revenue rulings that mirror the proprietary Catilize health plan in many respects. And while it doesn't, lay out all of the different aspects of the Catilize implementation of the SIRA, it lays out the broad base and foundation. One particular notice of interest to folks is Revenue Notice 2013-054, and they go so far as to specifically describe spousal incentive type MERPs like our SIRA. And again, like they don't spell out all the different proprietary aspects that we've developed and that we implement for our clients, but it gives us a very strong foundation beyond a reasonable doubt that we're legally compliant in every respect.
And so, but they can have that and have a higher benefit plan too, correct? They can have something next to the MERP?
That's correct. Yes.
When the ACA first came out, that's the first thing we said. We have to create this base plan, and then we can buy up to the other plans so we can base affordability on the lower level plan. So I just want to make sure that people were aware of that you can have them you can have them alongside of other plans. And I think that's...
Yeah, let me give you a quick picture. Remember back in the day when we all had indemnity plans and then they came up with PPOs, right, in the 80s?
Craig, you and I are the only ones that probably remember those.
Yeah, so you had indemnity and then you had PPOs and then you could add HMOs and then you could add EPOs and POSs. So the MERP or the HRA is nothing but a bolt-on medical plan that sits next to your other medical plans.
Right. Okay, great. Thank you very much for that explanation. Now, are these, in some cases, gap-filling plans or gap-filling strategies?
Well, that's an insurance-related question, so I'll take that one. Okay. So a gap plan, historically, if I had my AFLAC code on, I would tell you that they cover the things not covered by insurance. Well, they do it with insurance policies that require a premium to be paid. And thus, in exchange for a premium, when you have a claim like a hospital claim, a lot of gap plans will pay the deductible associated with a hospitalization or any claim that triggers a deductible. And in exchange for paying the premium at some point in the future, you can file a claim to get your out-of-pocket or deductible reimbursed. That would be a gap plan. These are not gap plans. There are no premiums. All HRA, the MERPs, the SIRA is 100% employer funded.
Okay. Sean, any add-ons?
Well, Craig did a good job. I don't have much to add for that.
Okay. Well, that's a first. Okay. Well, let's talk about the basics again. And these plans are self-funded, of course, right?
Correct.
So can you tell people a little bit more about that so that they understand exactly how they work with funding?
Yeah. So as an employer-funded medical plan, it's an ERISA self-insured, COBRA eligible, should have the same life qualifying events as your existing medical plan. The difference, nuanced but pretty large, unlike a major medical plan, the only eligible expenses coincident with a spousal integrated HRA are copays, deductibles, and coinsurances. which by definition are the ineligible expenses on spouses' plans. So the combination of your employer plan sponsor now paying the out-of-pocket expense and the spouse's plan covering the medical claims, participants can receive 100% coverage, 100% actuarial value medical plan with zero out-of-pocket. And thus, the attraction for people to want to enroll, because typically, unless you're as old as me, nobody's ever had 100% medical coverage. Remember back in the day, in order to get anybody to pay attention to a PPO, everything was 100%.
I do.
Oh my goodness. Yeah, long time ago.
Sean, did you want to add to that?
No, I don't. Other than, I was a personal participant in a Cadillac plan, as they called them, and did have that 100% coverage over my engineering career, which preceded, today, and noticed that, that was a huge incentive for folks. And I hadn't seen it since. After leaving large aerospace corporations, I, was in the private legal market as a practicing attorney, and the benefits were far less than 100%.
Yeah, for sure. Well, let's talk about plan design. Are these plans customizable? How can people look at it? Like, do they look like a normal self-funded plan? You can start with a blank piece of paper and design what you want. How does this work?
It is very flexible because there are so many moving parts. And within those parts, you can design eligibility rules, reimbursement rules. There are a whole variety of regs associated with a basic HRA. And so all of those regs could apply. When you integrate with a spouse's plan, it's different than integrating with the employer's plan. So there are provisions that don't really apply because it's not the same program. But the fact is, it's extremely customizable. We've been doing this for 24 years. So we've got a great depth of experience on how to modify these things. I know brokers like the term crawl, walk, run. So sometimes implementation looks like that, right? They start out with a basic and then they change things. I'll give you an example. The fourth largest sports brand in the world has been our client for well over a decade. And one year, self-insured, shock losses in December. Gee, what a surprise, right? And there were so many millions in claims out of nowhere that it caused the executive team to miss their bonuses. Forthwith, the benefits manager called us and said, that can never happen again, or I will be out of a job. So how can we increase enrollment in your program? And thus, you turn the dial, you make modifications and customizations, and we can increase enrollment. And coincident with enrollment are savings and increased profits for the employer plan sponsor.
Right. Sean?
Right. And, what enables us to do that is not only the 24 plus years of experience across our leadership team, it's our constant monitoring of changes to the Internal Revenue Code and ERISA, which are quite frequent. It would surprise most people to see how many changes happen year over year.
Right.
Right. And so those changes in the United States Code are manifested in the Code of Federal Regulations. And then suddenly you see a plethora of new revenue rulings and revenue notices coming out of the Internal Revenue Service with all sorts of, examples. And so when this particular client Craig referenced had those shock losses, we were able to, tune the dials a little bit and modify the plan and the SPD, the summary plan description, so it offered new opportunities for those employees and controlled costs in an even more robust way based on the employer's actual facts and circumstances of those particular shock losses. So, there's a lot of intertwining of the plan document and the administrative services agreement that enable certain things for the plan sponsor to do that will mitigate those unexpected circumstances, in this case, stop loss issues. But there's a whole host of other issues that pop up from time to time with different employers as, their employee-based changes and experiences, different types of health anomalies.
Right. Well, thank you for that explanation. And can they be used to offer additional coverage that maybe the group health plan, maybe the higher level plan doesn't offer?
It actually is possible. Technically, in the code, you can offer coverage that might be eligible. Let's say this. So you have a plan document. We all know we have exclusions in a plan document. And it's possible that some of those exclusions might be eligible under Code Section 213D. So if you wanted to, you could make the plan any eligible expense relative to 213D. You could even nuance this to say, if it would have been covered by my base medical plan, even though you're on the spouse's medical plan, we'll still pay the claim. Okay? Now, no one's done that recently. We've had it many, many years ago. But that just gives you an idea. You can't play with this for those who are listening. Okay. You
And
can't
watching.
afford the learning curve of people who don't really do this for a living. Okay. Because of the CAA, the aforementioned law passed starting in 22, I think, the effective date of that, you can't play with this because you could have personal liability. So work with a professional.
Absolutely. I agree. Sean?
And ask a lot of questions and get your lawyers involved because, typically most of our clients have very good legal teams, whether in-house or out-house, and they know the risks, issues, and opportunities this employer and its employee base have faced in preceding years. And so it enables us to have a very good conversation to, help their lawyers understand the risk mitigation for the personal liability piece of this, but also the opportunity for implementing slight changes to your plan design that enable additional benefits for your employees and better cost controls for the employer.
Well, thank you very much. And I want to talk about governance. We've talked about this a little bit. You guys started off with this and kind of, touched on it throughout, but let's talk about specifics in governance. What type of government oversight are we talking about here? I know, but I want to make sure our audience knows. Is the Department of Labor, the IRS, who's involved? You mentioned Section 105, I believe, of the IRS code and a couple of other sections. So just kind of overall tell us about governance.
Right. Well, I'll take that, and Craig can chime in. I'm all about the governance piece of this, and the governance is actually multi-layered. It's federal and state. There's state insurance commissioners that will investigate certain allegations of inappropriate conduct in a particular health benefit plan. But the real scary piece of this is the Department of Justice will knock on your door under the auspices of the Department of Labor, the Internal Revenue Service, and the Treasury Department. All three of which entities manage these compliance aspects of the health and benefits and welfare programs and employers. And so that's another thing we pay close attention to. We're looking at all the cases that are filed. Some of these start under the EEOC, the Equal Opportunity Employment Commission's programs, but then typically the Department of Labor and the Internal Revenue Service will get involved if there's serious issues. And that's where the personal liability issue comes in. There's no way, you may have great E&O, errors and omissions, or D&O insurance, directors and officers insurance, that protects against, mistakes by the leadership team. But that personal liability still attaches. And the only way to mitigate that personal liability is to ensure you've got a good corporate governance program. And so although our primary focus is as a third-party administrator, we're also a healthcare cost management consultancy in many respects. And we help educate their legal team and their C-suite teams as to how to best monitor and enforce and ensure your programs and benefits are in compliance. Obviously, Catilize Health does the heavy lifting on that. We'll design that plan document, which, sets out the KPIs, the key performance indicators of that health benefit plan governance. And so, in fact, we've been so successful, and our predecessor and interest entities have been so successful. We've never seen an IRS audit, and the Department of Labor has never come knocking. We've had a phone call or two, as best as I can ascertain, over the last 20 plus years of our leadership team's experience in the industry. And those were mitigated by phone calls. And once, we were able to recite code section, Code of Federal Regulations section, and this particular revenue notices and revenue rulings of interest, we never got a return phone call.
That's a very interesting thing that you said, that you've never had them knocking on your door. And I was expecting one of you guys to start knocking on wood during that. And I almost knocked on wood for you as you were saying that, as you're making that statement, because that is unusual. As you know, I get involved with a lot of these government audits and so forth, and it's never fun. So that's good to know.
I've got to add some color to that, Dorothy. Okay. So, we live in a universe where there are many megalomaniacs with inferiority complexes, I call them. And so employers need to be careful out there. And so unless your broker went to law school, and even if they did, I always enjoy talking to a risk counsel of, a Fortune 500 company, because it's relatively simple. They just don't know about it. And so when you're talking about 2013-54 and Code Section 125 and 213D and 419A, they understand that we understand. And so if you're talking to one of your consultants and they're alleging to be familiar with all these code sections, you need to be careful. It's probably worth a second opinion, because it's not an oops associated with messing this up. It's a big liability.
Yeah, that's definitely not an oops for sure. Well, you talked about plan documents before, and I want to come back to that. Obviously, because it's an ERISA plan, you need a plan document. So tell us a little bit about plan documents, summary plan descriptions. Do you do them in-house? Do you hire out for them? How does that work? And how easy is it for, an employer group to have that legal piece done on their behalf when they enter into an arrangement like this with you guys?
That's a great question, Dorothy, and I'm sure Craig will add some color to this. But the key piece of this is we're constantly attending to and monitoring and trying to understand different revenue rulings, revenue notices, and changes to the Internal Revenue Code and the ERISA code sections. Because one of the key things that brokers miss, they might be able to cite specific code sections like Craig just did, but they don't understand that these code sections are heavily cross-referenced to other code sections. And unless you really understand the intricacies of the Internal Revenue Code and ERISA and the interplay between them, you're going to miss key points, and that's going to cause personal liability. And so we've fleshed that out and ensured that our plan docs, our summary plan descriptions, are fully compliant and address those caveats, exceptions, exclusions in the Internal Revenue Code and ERISA. And so, our plan document, as you asked us, do we do it in-house? Do we use outside counsel? We use both. We're constantly searching for best-in-class intellectual minds that understand this as well as we do, so we can sound off or have a sounding board with these third-party outside counsel folks. But, basically we are almost OCD on managing our plan document templates and then our specific red lines to those plan documents that meets the facts and circumstances of a particular employer and its employee base. And so, we're, as we do that, we're always looking for very solid references, a very solid foundation in the Internal Revenue Code or the Implementation Code of Federal Regulations or the revenue notices and revenue rulings from the IRS.
Craig, did you want to add to that?
Suffice to say, we do everything turnkey on behalf of the employer plan sponsor. We've been doing this for over 2 decades, so it makes it very easy to bolt on one new medical plan, and everything coincident with that, from the paperwork to the enrollment to the communication, is handled by us.
Great. Thank you very much. I want to ask another question because, again, it's ERISA and so forth that's involved here. Are these plans subject to non-discrimination rules?
Yes, they are.
Yeah, I'll add some color to that. Yeah, so in fact, the discrimination rules prevent employers from discriminating in favor of highly compensated employees, generally speaking. Of course, there's exceptions and exclusions. But one of the things that most folks miss, including, 30-year in the business ERISA counsel, is that code section that prevents discrimination in favor of highly compensated employees does not prohibit discrimination in favor of regular employees. So we can tailor a plan and a summary plan document to create favorable conditions for reimbursement for the employees. And that's where we, will tweak the plan, fine tune the dials, and make sure that the employer's specific facts and circumstances are going to create those benefits for the employees. And one of the things that strikes me is, Craig mentioned we do this on a turnkey basis for all our clients. Well, one of my goals is to have a standard template that, addresses all those potential caveats so that it's a menu of options. We can quickly redesign that plan for that particular employer. But I got to tell you, over the last just 3 years, thinking about the plan documents we've put together, every employer has a different set of facts and circumstances and has created new challenges every single time that forced us to go back to our code sections and revenue rulings and revenue notices to make sure we had the right governance and compliance features built into that plan design and the SPD that comes out of that.
Right. And I can attest to that because as a lot of the audience knows, and you guys know, I ran a TPA for many years. So this is something that, those are all important things that people need to understand before they do work with an organization. They want to know exactly where the background is. They want to know how much experience you have. They want to know all these things. How much attention are you paying to all these different items? So I'm glad you guys are talking about this today.
Dorothy, you think that what you just said was true. But I can tell you from experience that there are administrators out there that aren't even licensed as a third-party administrator in a single state performing functions similar, or at least within the genre of HRA administration. So once again, employer plan sponsors need to be very, very careful and actually ask questions.
Mm-hmm. Mm-hmm.
right?
Right.
Are you a
And
licensed third-party administrator in this state? How about that for basic fundamental 101?
It should be. Yeah.
Because nobody asks.
I know. I do.
Right,
well,
exactly.
and people will ask and they'll get an attestation of yes, but they don't go check. We've had a couple of clients that were approached by others that were masquerading as TPAs with fantastic, data analytics and other promises of great benefits. But turns out it was just empty vaporware. They had no license, no actual experience in the third-party administrator space. And nobody ever went and researched it. I did because every insurance commissioner in every state maintains public record databases. And so we try to ensure compliance from that respect. But the other thing that stands out in my mind based on, from your question, Dorothy, is plan design is not fire and forget. During the open enrollment, we'll look at it again and make sure it's compliant, but things change every day. And one of the things Catilize does that we haven't found anywhere else in the industry is we're watching for those changes, and we'll notify a particular employer that's got particular facts and circumstances that might be affected by some of these changes so that we can do an amendment to our plan document, our SPD, and even our ASAs and our BAAs, our business associate agreements, so that we can ensure that the plan changes with the ever-changing legal landscape.
And I want to come back to a basic question, which I think most people know, but again, I'm supposed to take the stand here of knowing nothing so that the people that are watching or listening to this will learn from it. So are these plans entirely funded by the employer or not?
They are 100% employer funded. So keep this in mind as an employer plan sponsor. I can tell you unequivocally, hundreds and hundreds of conversations with employer plan sponsors, air quote, health managers, that might be a CHRO, VP of benefits, VP of total rewards. To a person, they all say they love their employees and we're very paternalistic. So at the end of the day, you need to ask yourself this question, because we haven't really gotten into the nuts and bolts of, well, why does it benefit an employer?
Mm-hmm.
Okay, well, I just want you to think about this. If you love your employees and you're very paternalistic, then how on earth could you allow someone on your internal team to deny your employees the right, coincident with open enrollment, to elect to enroll in a medical plan with 100% coverage and zero out of pocket? Knowing that by doing that, you will lower your claims experience. And as a self-insured employer, you are in fact a health insurance company as a separate line of business. Sadly, most C-suites are not involved in operating a business, and they assign it to someone who's normally in charge of compliance and administration. So you have to understand that if I can lower my claims, that means that everyone in the organization has a more competitive renewal, up to and including zero rate increases. Now, the fact is, many employers, because they have no ability to control the frequency and severity of their claims on their self-insured medical plan, each year, hope is their biggest strategy. And so the consequence of that is when you offer your employees a 3.6% pay increase, it actually doesn't cover the increase in the health insurance premium contributions that you charge them, because you are unable to manage it. And so when you're looking at alternative strategies or point solutions, you have to strongly consider, is there a way that this solution can control the frequency and severity of claims? And if so, is it a one-time hit, or is it on an evergreen basis? Is it going to be the same savings every year, or is it going to increase? What's going to happen? What's the impact? Because what I know is the participant will have the best coverage they've ever had in their life. The entire organization will have lower rate increases, up to and including no rate increase. And the company will make money, because if you own a health insurance company, you pay claims from the profits of your company. And if you're not paying the claim, your profits are increasing. So that's the point of all this gibberish, right? How do I control my self-insured healthcare budget while actually increasing the benefits to my team members, associates, and employees?
Right. And what's astonishing about what Craig just said is most companies, their number one, number two, or number three cost is going to be their health and benefit plan. And so the fact that the C-suite, the CFO, the CEO will defer that to someone who doesn't manage the balance sheet and the P&L is an extraordinary problem for a lot of these companies, because failing to manage that properly from the C-suite creates that personal liability issue for the fiduciaries, because the officers and directors are typically designated as the fiduciaries. And so that's going to be a huge risk, which we can mitigate.
Right. Right. And there are obviously this is a topic for a different podcast, but the fiduciary responsibilities are crazy now between the Department of Labor coming out with cybersecurity guidance in 2021 and then updating that in 2024, between all these other things, the CAA and all these things that they put on personal liability. I mean, this stuff is huge. So I'm glad you guys are talking about that. That's really a nice add-on to what we're talking about today. So I appreciate that. Let's talk about one other part of this that I think people should be aware of and would want to know about, and that's the tax benefits. What are the tax benefits of these plans?
The tax benefits, well, it's the exact same as your current self-insured medical plan. The difference is you have, let's see, most recent survey that I saw, 72% of CFOs said that the healthcare budget is the most uncertain budget that they, quote unquote, manage. So what are the tax consequences? What are the advantages to the employer plan sponsor? With confidence and certainty, you can lower your self-funded claims. The second order consequence of that is you're going to increase the EBITDA or profits of your organization. The third order consequence of that as a C-suite executive is your direct report, the CEO or the board of directors, is going to be very happy because you can do this with a bolt-on solution that doesn't require you to fire, modify, change anything or anyone you currently work with.
Just so you know, the reason I asked that question is, again, I'm trying to ask the questions on behalf of the audience, right? And some employers just aren't familiar with this. Let's say they have a fully insured health plan, and then they're using a MERP on the side of that. So they're not familiar with all these ERISA items that we're talking about. This isn't something that's day to day for them, like it would be for a person or a company that's self-funded for all of their medical plans. So that's why I wanted to ask that question, because again, a lot of people wouldn't understand that unless they're self-funded in their medical plan as well, right? That's
a different angle.
Plan.
Yeah, I can address that.
Yeah.
Dorothy, that's a good question. And the answer is it depends. So is the employer plan sponsor fully insured or are they self-insured? If they're fully insured, are they 100% experience rated or are they in a pool? So the reason I differentiate is because if you're in a pool with, say, Anthem Blue Cross, you're going to get the pool rate increase regardless of whatever cost-saving structures you've designed. You're still going to get the same pool increase. So you really have to ask yourself the question whether, the juice is worth the squeeze. If you're 100% experience rated, fully insured, that's about 4% of our clients. The fact is, I would call it semantics. You are self-insured because your fully insured premiums are merely a mechanism by which you pay the premiums on a level basis each month. The fact is, if your rates are based on your claims, you're in essence self-insured in that sense. And so the consequence of that is you want to be aligned, if you're self-insured, which is the only way to control your costs, with a mechanism like this. The challenge depends on states, right? So we go down to Louisiana, they're 100% experience rated at 100 lives. You come to California, it's going to be much, much higher, hundreds of lives. We kind of obviate that risk because our typical client is 500 employees on the medical plan or above. It's 100,000 down to 500. Sometimes we do friends and family deals with people we like, maybe down to 300-ish.
Dorothy, if I could interject, to your original question, I heard what are the tax consequences of plan design? And, the bottom line, everybody knows this, but few people know how to implement this properly. But the tax consequence and the risk is that the expenses paid by the employer are no longer deductible if the plan's not compliant with the ERISA requirements. And that's a big if. Obviously, our clients, we haven't seen the DOL or the Internal Revenue Service come knocking, but there's plenty of reports in the media. If you Google around, you'll find that there's quite a few folks that are suffering enforcement actions. You alluded to the fact that you've seen it with other TPAs. We've heard about it in the industry, but we're very aggressive in trying to mitigate that before it happens. So the only, two instances I mentioned were phone calls where we're able to dissipate their interest in investigating our client further by demonstrating compliance. So the tax consequence can be severe. All of a sudden, you can't write off those health and welfare benefits as legitimate expenses, and then you have to pay penalties and interest because you deducted too much because you had improper plan design.
Yeah, and you actually touched on some of this at the beginning of what you were just saying. My next question was going to be, what's the impact on the employee's taxable income?
Oops. Yeah. So a health reimbursement arrangement, reimbursements are income tax free to the participant, unless, of course, it's found to be null and void, in which case then imagine going to all of your participants and saying, that tax-free reimbursement we gave you the last 2 years, you're going to have to file new tax returns because, in fact, they were all now taxable. That could be very problematic for a consultant and the employer and the employee.
Yeah, because taxability begets penalties and interest. The IRS wants to be paid for everything you didn't submit as a tax payment in the
Yeah, they're
prior
funny like
years.
that. They're funny like that. They want that. They want that money. For sure. Well, let's talk about, again, we've been talking about this all along, but the spouse coverage under the MERP. So a lot of companies, including yours, are offering these plans that employers are using to enroll into their spouse's plan rather than the employer's health plan. So tell us more about this. You've already talked about this a bit in the beginning, but let's come back to that and let's really kind of make sure people are fully aware of what it is that you guys are doing here.
Well, in America today, many people cannot live on one income. So there's lots of dual income working families. And the majority of those employers, 15 years after the passage of the Affordable Care Act, they have group medical coverage. So our plan will integrate with a group medical plan, not Medicare, Medicaid, TRICARE, Skinny Mec, or an individual policy or a standalone HSA at the spouse's company. It's my qualifier because Sean's on the call. So what happens every year? We have this thing called open enrollment. And coincident with open enrollment, people have the right to elect which plan they're going to elect. Hey, honey, how much are your premiums and how much are your deductibles? Let's compare. Should we go on your company's plan next year or should we go on my company plan? Hey, which plan should we put the kids on next year? And so these are discussions had by millions and millions of people every year. And when you interject a new offering of 100% coverage with no out-of-pocket, that attracts the attention of eligible participants. Eligible participants would be dual income families where each has a group medical plan at their employers. And so families can leave your self-insured base plan and join the spouse's plan. The spouse can join, you can stay, the kids and the spouse can go and you can stay. It's open enrollment. Everybody can make an independent election. You can split up your family. That's disconcerting to many administration software programs out there. ADP comes to mind. Although they have about 7 different programs, one of them can't split the family. So these are just little things you run into when you work with this every day. You start to already see the problems in advance, and you can allay those roadblocks on behalf of the employer. So I hope that answers the question. This is about an open enrollment election so that you can offer 100% medical coverage to eligible participants, and they can make the decision for themselves. Now, you're allowed to actually steer through eligibility. You could steer participants to be only eligible for the spouse's plan. And when you do that, you're going to, drive enrollment into those programs.
Sean,
Another flexibility.
Yeah. Did you want to add to that, Sean? You have that look on your face that you wanted to add.
No, I didn't. But the look was Bratz. He's taken the wind out of my sail, and I have nothing to add.
So obviously you guys have had these conversations in the past about all the legalities and all this stuff. Well, then we'll move on.
I have to, and I have to be very careful. I mean, Craig's as good as most of the lawyers I know out there on ERISA, so I've got to really up my game day to day.
I can relate to that. Let's move on. What types of medical expenses are included under MERPs? Let's talk about that. Is it just medical? Can you have dental and vision and so forth? Expand on that.
Yeah, because you ran a TPA, you understand this. If a dental or vision claim qualifies as a medical expense, it's reimbursable. Otherwise, it's not.
Okay.
You use your dental plan for the dental reimbursement. You use your vision plan, your FSA. So it just depends on if it qualifies as medical.
Okay. Sean, did you want to add to that?
No, that's a perfect answer. Thanks,
okay.
Craig.
Okay, good. Can the employer set specific reimbursement caps under these plans?
Absolutely. Yeah. It's completely customizable. I will tell you that from a plan design feature, 99% of our employers go with a specific recommendation that we make, but it is very flexible.
Yeah, that's good to know. So what about plan members' access to their benefits? I know a lot of times these accounts are attached to debit cards and so forth. Explain that to us.
Yeah, I know that there are debit card / Visa card administrators out there who will tell you that the POS software at all of the CVS and Walgreens are all perfect now, and they file only eligible claims through a cafeteria plan, blah, blah, blah. It's not true. You cannot have an auto adjudication administration of an HRA. you have to require substantiation. Those cards are not infallible. Probably their biggest exposure to an employer, in my opinion, is the fact that you can't know that the person who incurred the claim was an eligible participant in the first place. And thus, you auto-adjudicated a claim on an ineligible person. And therein lies the rabbit hole that you go down, because now you've done it hundreds and thousands of times. And it's very easy. It's very easy to point out. And so with the lack of substantiation related to those programs, you can't do that. We adjudicate every single claim manually. There is no auto adjudication in our program. Now,
Really?
That's our opinion. You take your risk however you want to.
No AI?
Zero.
I have to ask that question because everybody's asking about AI claims today.
We're actually the only, we're looking at AI to scan in billing codes and things like that. Yeah, but no auto adjudication.
Okay.
Well, in AI is just like an apprentice level administrative assistant. I mean, you have to monitor and supervise, and therein lies the rub. You've got to have good corporate governance and compliance framework on top of your plan design so that you ensure as you adjudicate each claim, you do it properly and you maintain compliance with the ERISA requirements. You also mentioned, one of the big changes was the ACA and the HIPAA changes, imposing additional data privacy and cybersecurity rules and regulations on folks. And we were aware of it from day one, and we were able to modify plan design, our ASAs, our administrative services agreements, and our BAAs to provide our clients with perfect templates that ensure that they've not only got good black letter law implemented in their plan design, but that they can implement reasonable governance and compliance internally as the plan fiduciaries.
Hey, I got one for you, Dorothy.
Okay.
We recently had to go through a couple of times what's called a penetration test. So for those listening who are unfamiliar with that terminology, we have to pay a third-party company to hack us.
Mm-hmm.
Yeah. Why don't you ask your TPA if they've ever had one of those, if you're a prospective employer plan sponsor?
Right. And I'll add a little color to Craig's comment. I mean, this arises under the typical SOC 1 Type 2 or SOC 2 Type 2 certifications that a lot of companies will advertise. And it's been my experience, and I'm sure Craig's experience, that they short circuit a lot of those testing and other types of compliance investigations. We don't. We do a full-up penetration test in addition to doing control tests of all of our adjudication methods and all the different aspects of our plan design so that every year we ensure we're implementing best practices. Again, everything changes. Facts and circumstances of employers change. The code changes, the Internal Revenue Code, the ERISA code, and that creates new potential liability issues. So you've got to constantly be monitoring these things and ensuring that not only Catilize Health as a TPA and a consultancy is making sure we're compliant, but helping our employers, the actual plan fiduciaries who are liable, have the confidence to know that they're compliant, their plan design is compliant.
Right. Well, that's important to me. As you guys know, I've been doing this for quite a while, and compliance has always been my thing. But I mentioned the DOL cybersecurity guidance that came out in 2021 and then updated again in 2024, I believe. They do actually require all the vendors, including third-party administrators, to have all these types of tests going on a regular basis. And they expect the plan fiduciaries to have a record of the fact that they're verifying all these things. And I actually put together a fiduciary package shortly after the DOL regs came out. And because it's so important and people you can't forget about this. This is important. And this is something that they require. And now it looks like the final HIPAA security regs are going to be coming out soon. I believe it's on HHS's agenda for their May meeting. So those proposed regs will probably be final regs pretty quickly after that. So it's really important. And I'm glad that you mentioned that penetration testing is something that's really important and it's required, and people don't really take that seriously, but they need to take it seriously. Once those proposed rules become final, which is not too far off in the distance, they're going to really have to take it seriously. And again, fiduciaries need to be monitoring their vendors like third-party administrators. So it's good to know that you're already being preemptive on that, because most administrators that I've worked with in the past and those that I've done consulting work for and just those in the public in general, they're not really paying as much attention to that as they should be. So those are good points, and I'm glad that you made them. Now, I want to come back to something else. And actually, Craig, you mentioned this earlier. We haven't talked about this yet, the benefits of this and so forth. That's because I was planning on doing it now. So I'll bring it up now.
Yeah,
we touched on it. But let's talk about the advantages and disadvantages of offering these plans. Let's start with the advantages.
The advantages of offering a spousal integrated HRA. Well, as we mentioned earlier, you love your employees and you're very paternalistic. You're managing what is historically the most uncertain budget that you have, your self-insured medical healthcare budget, which for most employers is their second or third largest operating expense after payroll. Mm-hmm. And the consequence of that is your profits are down, your enterprise value is down, the amounts that you can love your employees goes down because there isn't money available. We all know that the lack of retirement savings for working Americans based on the balances in their 401ks is frankly, it's embarrassing. One of the things that I like to talk about personally is what are you going to do with the savings that we know are going to be delivered as a result of this strategy? Well, might you consider offering an increased employer plan sponsor contribution into the 401k plan? Because God knows everybody needs more retirement savings. Almost no one can afford to retire based on that balance in their 401k. So there's a lot of, the reason I bring that up is it's not just as obvious as, this is some PBM point solution, and if you do this, then this will happen. Okay, there's lots of consequences to making a decision. And so the advantage, if you're a participant, no one's ever had 100% medical coverage with zero out-of-pocket expenses before. So imagine this. I'm going to put my actuary hat on. It's very pointy. And so what happens? We know that 50% of a workforce will incur 3% or less of the claims. 1% incurs, it depends on the group, 30 to 40% of the claims. 1% of your members, 5% incurs half. So if we know, based on all of the surveys for the last 25 years, or 40 that I've been in it, we know that based on those surveys, the majority of working Americans self-identify with living paycheck to paycheck. So you're living paycheck to paycheck. 53% of Americans are in a high deductible health plan with an average out-of-pocket expense of $5,000 before they convert to 100% coverage. You're broke, you live paycheck to paycheck, and you're part of the 5% who incurs half the claims. How interested do you think those people would be in a 100% medical plan option? They'd be very interested. And we have 2 decades of experience to tell you that a small enrollment can have a very large impact for all of the employees and the bottom line of the organization. So that's the participant. The non-participants, you're self-insured. Prices, premiums, costs are based on claims. If you know you can lower your claims, the costs will go down for everybody. Quick story, health insurance company. We had a health insurance company as a client. Their biggest competitors are Anthem and United. They needed a way to compete on a different basis. So they installed it in their own workforce just to see how it works, make sure it all works. They're on their 5th year of no rate increase, Dorothy.
That's unheard of.
Think about that. 5th year of no rate increase. It worked so well after 18 months, their chief actuary called us and said, we want to embed you in our commercial medical plan that we sell to employer plan sponsors so that we can compete on a different basis than United and Anthem. And so we've been working with them for years. So you've got all of the non-participants in your organization, all of your employees can benefit from having lower claims.
Right.
And depending on who I'm talking to, if I'm talking to the CFO, the CEO, or the board, your EBIT is going to go up, guaranteed. Because here's what your consultants don't tell you. There's only 4 things a consultant can really do for you at the end of the day if you want to oversimplify this. Avoid risk, reduce it, retain it, or transfer it. And for the 40 years I've been in healthcare, I've watched, as have you, Dorothy, dozens and dozens, at least a half a dozen every year, right? That brokers who love shiny objects will, pay attention to. Total waste of time, okay? They don't work. Everyone's rates have at least tripled in 20 years and probably doubled in the last 7 or 8. So if all these best practices worked, I would posit, wouldn't your rates reflect it? And in fact, 99% don't. So you have this runaway expense that's hard for people to manage, and yet the industry tells you how to avoid, reduce, and retain risk. Wellness, health promotion, RBP, direct contracting, bundled surgical, yada, 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 yada. What I would propose to you, if you're an intelligent plan sponsor, transfer the risk. Avoid, reduce, and retain has minimal impact over time. If you transfer the claims risk off your balance sheet, you will save money for everyone and build the value of the company. And so that's the advantages. The disadvantage is simple. If you choose not to listen to the prevaricators out there, you will understand. Here, I'll give you a question that every plan sponsor should ask. when their hyperbolic consultant comes to them. Tell me how this will reduce the number, size, and frequency of claims this year and every year going forward. And watch them. Right? It's gonna sound like this. Okay? That's what I would tell you from experience, having seen this many, many times. Just ask them to be accountable and explain how it's going to do, and then you'll have something to compare it to, because frankly, the disadvantage is in not doing this. You are willingly, knowingly, negligently passing on a mechanism that could prevent any CAA litigation on the tail end of your decision making. And the fact is, most C-suites never even hear about it because the healthcare manager never shares it with them.
I was just going to say, spoken as a true company president and a person who's been in the industry for so many years. I want to come back to Sean for this because I think you might have a couple things to add to that. Would you have any add-ons for the advantages or disadvantages?
I did, but Craig just kept talking and covering most of those. I would just offer to amplify the advantage and disadvantage, which was the original question. And the question that in my mind, as a business owner in prior lives was, what are my competitors doing? Are they going to get the benefit of this, or am I going to take advantage of it? Am I going to increase my margins by controlling the one piece of my budget that's uncontrollable, or am I going to just let my competitor do it and gain market share because they can lower costs to their customers? And it's very simple arithmetic. I want to be the one that's going to take advantage of this Catilize type CIRA to lower costs, because like Craig said, it lowers costs for the entire population, not just the folks eligible to participate who have coverage available elsewhere.
Okay, let me
Dorothy,
ask you another question.
I've got to give you a competitor story since he opened the door. Okay. Well, in a sense, if you look internally within the dynamics of a corporation, union, non-union employers, somewhat competitive, right? So I want to tell you a quick story about how we installed it in the non-union population first. Employees talk to each other. They know what's going on.
They do.
And when union membership found out that the non-union members had a medical plan that was vastly superior to the union membership plan, well, it led to a very quick meeting of, how do we get one of those and when can we have it? So to give you an idea of the power of offering 100% actuarial value medical plan to your workforce.
Great. Anything else that I stepped on there? So I didn't mean to step on you. So just want to make sure. Okay.
Well, I got a million stories, so yeah.
I'll bet. Well, let's move on to another topic, though. When we've talked about this already, you guys have talked about it from time to time throughout this podcast, but let's talk about the legal documents that plan sponsors have to sign. You already talked about the fact that they need a plan document, so we know that, and they need a summary plan description, so I'm going to skip past that. But what about those other things that they need to be aware of and make sure that they have executed? Things like business associates agreements and service agreements with the administrator and so forth. Do you have, I'm assuming you have those. Do you have are they your own, or do you have, for example, your BA agreements? Are you getting them from someone else? Have you done those yourself? What about your administrative services agreements? How are those customized? How are those handled for your employer clients?
Right. Well, I'll jump in because once Craig gets a hold of this, I won't have anything left to say. But, just like we manage and control very carefully our plan documents and our summary plan descriptions, we do the same thing with our ASAs and our BAAs. And there are many flavors depending on the type of client. And so we've got many great starting point templates. We put those out for review by third-party outside counsel who are deemed to be best in class. And that's ever changing as people retire and new folks come up. And, new litigations, give us new potential advice and counsel to, mitigate potential problems that came up in past controversies. So our documents, our plan documents, our summary plan descriptions, our ASAs and our BAAs are living and breathing. They're constantly changing and improving as the marketplace changes.
They need to be, actually. That's a good response. Did you want to add on to that, Craig, or is that good?
No, that's wonderful. The only nuance I'd add is depending on the industry, sometimes in healthcare, we have some unique provisions related to healthcare-related companies because there are additional benefits for those organizations that a regular employer plan sponsor does not receive.
Right. Yeah, absolutely. Tell us a little bit about your administrative services. You kind of talked about these throughout the podcast here. Let's talk basics. Where are you located? How many locations do you have? You've already talked about the fact that you've been in business for over 2 decades. So just give us a little bit of, basics about the administration side of the business.
We're primarily located in Pittsburgh, Pennsylvania. We also have a claims paying office in Aliso Viejo and are exploring locations in Florida for expansion.
And you have employees scattered also throughout the nation, right?
We don't really have remote workers other than sales team. Everybody's either in California or Pittsburgh.
Okay. So, but you do have employees in other states, so you do have some familiarity with the other states, I would assume.
Yeah, oh yeah, we have clients in, I don't know, almost every state.
Okay.
Right. I mean, in fact, we have clients and TPA licenses and other types of, corporate reporting across over 42 different states. So everywhere we have a client or a salesperson or an employee, we are extremely familiar. And, of course, again, we're monitoring changes in all 50 states and at the federal level. So we're constantly looking to improve and ensure we're compliant. If there was, 5 or 6 additional states where we don't currently have clients, we're already ready for that. So when clients do pop up that need help in those states, we'll be prepared.
Speaking of Hawaii, if you have any of your listeners are from Hawaii, feel free to reach out to us because we'd like to do an on-site inspection.
Wouldn't everybody? I actually love that. When I had a couple of clients in Hawaii, I used to love having to go out. I think I need to do a site visit. I think it's about time. I haven't been out there for a few years.
No doubt.
So let's meet on the beach in Waikiki. Okay. Well, let me ask you a question because I think this is important. You work with brokers a lot. And yep. Unfortunately, sometimes there are situations where brokers shy away from these kind of plans because they think they're not going to get compensated as much as they would in a big fat premium plan like like a fully insured platinum level plan, right? So what do you do about that? What do you do about that kind of preconceived notion of brokers that they may not want to even offer this to their employer clients? That
falls under one of Craig Lack's rules of business. The answer is money. What's the question? So, yes, suffice to say, let me tell you this. We work with every national house in America, right? Big box chain store to, independent to regionals. And we have multiple brokerage firms that we pay 7 figures in commissions to. So as an organization, we charge a PEPM and a performance fee and have for 24 years. And we share that performance fee with our distribution partners. Sometimes that's people like Sean, lawyers, who refer us to boards of directors and CEOs and CFOs. Sometimes it's a 401k person. Sometimes it's an employee benefits broker consultant. It could be from anywhere.
So basically,
and sometimes it's the general manager in a union who's looking to say, hey, how do we get that plan for our union membership?
Yeah.
And we're very familiar with the Taft-Hartley rules and can help them design that plan properly.
So bottom line is that you can make it worth it for a broker to offer these kind of plans because they can receive compensation in other ways. They can receive broker fees. They can receive all kinds of different types of scenarios.
Yeah. In our market, it's mostly they're on fees, right? But there are still guys out there and gals out there on commissions. And so it's just math. You look at it, if 15% of your people go over there, what's the expected revenue to you compared to your fully insured premium, whatever it is.
Although we know that brokers and consultants are supposed to always do what's best in the best interest of their clients. Unfortunately, sometimes that kind of shadows the picture.
The thing that gets brokers normally is, hey, if I lose one piece of business to some point solution, it's an accident. If I lose 2, I better pay attention to that, right? I think that's how some of the captives have grown by getting brokers to pay attention. So it's one of those things where if you want to build a moat around your client and protect them, this is the best way to do it because let's face it, the payroll company's after you, the bank's after you, the P&C's after you, other healthcare brokers are after your case. So you better build a moat around it so that you can sit down with the CEO or the CFO and go, I produced $800,000 in profits for your company last year. And they'll go, how'd you do that?
Yeah.
And now you've just changed the conversation away from how much are your premiums, what's the rate increase, and all that stuff.
Right. And it's our intent to incentivize those brokers because they should be compensated for doing the right thing for their employers.
Yeah.
Yeah, absolutely. Well, let me ask you one final question. Are there additional cost containment options in brief, because we've already covered a lot today and we don't have a lot of time left here, that you can offer alongside of or in addition to a MERP?
Well, for purposes of this call today or this podcast, I would tell you that we've just initiated and been approved for a 501c3. And so for some of our large, what I'd call jumbo clients, sometimes they have, I don't know, this feeling that they want to have equal benefits for everybody. Now, I'm always, that guy to go, equal doesn't mean equality, right? Because you have one medical plan for everybody, and the CEO wears a $20,000 watch and drives a $100,000 car and has a $1,200 deductible, and so does the receptionist who makes $40,000.
Right.
How is that equal?
Right.
But I digress. So we don't go down that rabbit hole. So the fact is, we have the ability through our foundation to provide interest-free and income tax-free loans to participants based on financial hardship and need. And we work with internally the CHRO team in defining what eligibility for those things will look like. Compare and contrast, there's a thing called an LSA, life savings account, lifestyle savings account. Many of those benefits, if you offer that as a formal program, many of those benefits will be taxable to the employee. And so we eliminate that wrinkle because this is a charitable foundation, and we can provide these hardship withdrawals with interest-free, income tax-free. So who would it apply to, Craig? Well, what about the single guy who doesn't have a working spouse? See, now they could have a $2,500 benefit to pay off a credit card bill, to get their car fixed so they can go to work, whatever it might be. That's a cool new wrinkle that we think is going to be very attractive to parts of our market.
And the reason I asked that question is because Sean and I were having a conversation a couple of weeks ago, and he happened to mention that. So I wanted to ask that and see if that would come up in this discussion, because I thought that was an interesting add-on that you guys were doing. So I wanted to make sure that we mentioned that today. So thank you for that.
Yeah.
Sean, did you want to add to that?
I would only add that there are other additional plan design options we can implement that enable certain high-cost claimants to have benefits that they might not otherwise have under the SIRA. So we've got additional strategies and other proprietary methods that we can implement to address the entire employee population in different respects. But again, as Craig may have indicated, out of the scope of this particular call, it's a whole nother podcast.
Yeah, I get it. Well, thank you so much for all this great information. This was really good information that people need to be understanding. And like I said, I wanted to come at this from the perspective of the employer that maybe didn't know anything about this. So that's what I was trying to do today. I just think this will be really important podcast for people to pay attention to. So if anyone should want to reach out to you, how would they do that?
They go to our website, catilize.com, send an email inquiring. That's probably the easiest bet. Otherwise, my email is craig.lack@catilizehealth.com.
Okay. Sean?
I would add that Catilize is spelled Catilize, Catilize Health.
I'm glad you did that because I misspelled it the first couple times. So I'm glad you
Right. Many people do. But it's easy to Google. We're all over the internet, so it's very easy to find us.
Okay.
If you fast forwarded to the end, let this be the example of why you guys need to seriously consider hiring a consultant like Dorothy to cover your butts, because she dropped the mic a couple times today.
Thank you for that. I appreciate it.
And I would add Dorothy to the list of outside consultants that we hire that are best in class. She's looked at our ASAs and our plan docs and has had great advice and counsel. So we consider you, Dorothy, to be a terrific partner in the industry. Thank you.
Thank you, and thank you guys for having the confidence to bring me in. I really do appreciate that. So thanks again, you guys, for your time today. I really, really, really appreciate you.
Have a great week. We appreciate you.
Thank you, Dorothy.
Thank you, and to our audience, as always, thanks for watching and thanks for listening. Please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Fullerton, California. All views expressed are those of the host or interviewees and not necessarily those of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 102 or toll free at 866-658-3835. By email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.